The intended audience for these modules are nursing assistants and caregivers on the front lines of providing care for patients and nursing home residents. The information contained in this module is relevant for anyone, whether or not they work in a caregiving capacity. The purpose of this video is to share information to help people use language that avoids adding to the burden of stigma already experienced by people with substance use disorder. This video consists of audio and visual information. There are additional resources at the end of the video to further explore the topic. Stigma about people with substance use disorders might include inaccurate or unfounded thoughts like they're dangerous, incapable of managing treatment, or at fault for their condition. So where does this stigma come from? Stigma around substance use disorder may come from old and inaccurate ideas or a fear of things that are different or misunderstood. Historically, there was a strong belief that substance use disorder was caused by someone being weak or having a bad temperament. In this way, it was viewed as a moral issue or an issue of character rather than a medical issue. Today, we know that substance use disorder is a chronic and treatable medical condition. We also know people can recover and continue to lead healthy lives. Fear of stigma can lead to people with substance use disorder being less likely to maintain social connections with family and friends, which leads to social isolation. People may also be less likely to seek help because they're afraid of being labeled or stigmatized. Stigma can also lead to discrimination, which can look like an underfunded treatment system for substance use disorder, discrimination in insurance, employment, and housing. Stigma can also create barriers to receiving evidence-based treatment and compassionate care. One way to combat or lessen the impact of stigma is to use person-first language. Why does person-first language matter? In short, it prioritizes people, not the problem. When we use person-first language, we put the emphasis on the person as a human being and not their diagnosis, condition, or challenge. This is a way to reduce stigma and empower people to take active roles in their care. Person-first language is not just important in substance use disorders. An example of using person-first language might be to say, John has diabetes, or John is a person with diabetes, instead of John is a diabetic. Use terms like person with a substance use disorder and a person in recovery to emphasize the person has a disorder, not that they are themselves the problem. This helps avoid negative stereotypes and reducing a whole person to one aspect of them. When talking about people in recovery, we can talk about how a person is not drinking or not taking drugs or has tested negative on a drug screen. Using medical terminology can help reinforce that substance use disorder is a medical illness and helps us avoid stigmatizing language that talks about cleanliness, since that can feel overly judgmental. Using the term medications for substance use disorder avoids the misconception that medications merely substitute one drug for another. Using non-stigmatizing, person-first language is a conscious choice, and it will likely take some effort to adjust. Stigmatizing language still persists in the media and even in many medical and care settings. If you're in a situation where you don't know what the appropriate language is, simply ask. On occasion, we may be in a situation where we hear a person with substance use disorder refer to themselves as an addict or a junkie or other terms that seem stigmatizing. This is their personal choice. How that person chooses to self-identify is up to them, but that does not give us permission to use that same language. What is most important is that you work to see the person, not the illness or disorder. Every person is so much more than the challenges they experience. Hearing the stories of people who've experienced substance use disorder is a powerful way to combat stigma. We've included a video of one such story in the resources section. Here are a few resources to further explore ways to combat stigma. In other videos in this series, we discuss the definition of substance use disorder, how to find help for substance use disorder, and prevention strategies.